Hey everyone, this is Rich. I'm joined here today with Suzanne Fox. She's a physical therapist and she also works with me in plant-based coaches. And we're also joined with Sherry Toby, who's going to be helping out in the background. And she also works for plant-based coaches. And again, our guest is Dr. Sunil Pai for part two of our discussion. It was a very well-informed discussion last week, and I learned so much, especially about the microplastics.
Yes.
And Dr. Pai really got me thinking about it. So my first question for our audience is there anything we could do about it if we have these plastics accumulating inside of us?
Well, so so far from the what I've researched is that there is nothing that's the direct like detoxification or product to take um, to eliminate microplastics. So the first thing I would look at is uh, lowering the amount of ingestion. That's the first key intake advice I would give, meaning making sure that your water is filtered using, what the data shows is that when we look at like reverse osmosis or using like things like Berkey filters and stuff like that, we're trying to remove not only just microplastics, but we're also looking at removing all the other heavy metals that are in the environment. And if you go to environmental working group and you go to, the water database, you Google that, you'll see you can put your zip code in and you'll see like your municipality and you can find your little local water municipal area because many places have different ones. So you live in a big city, it'd be a big one, but some places have like, oh, I live on this side of town and there's slightly different water systems. And it will tell you like how many contaminants are in the water and then how many are elevated past what we consider the environmental working group standards, which is kind of the standards that we want, like Europe and everybody else who are a little bit less more conscious and more careful about chemicals and exposure to the public than say here in the United States. So it will give you those levels of what they found in their area, and more importantly, it'll show you a little graphic of carbon filters, which most people have, like a Brita or a Pure or something that goes in the refrigerator. Those little round things that you screw inside, or the back they usually have a little pipe. Those are those are carbon filters, and they're helpful at removing certain things. But you can easily see in certain areas. Like yesterday, I had a patient here, and she had very high arsenic and uranium. And when we did her nutrition test, and that's just that's what's coming out of her body. So we're not challenging. We're saying here, just do the urine test, see what's coming out. And in Albuquerque here, we have high arsenic and uranium. That's if you look at the report, that's just something that's high naturally where we live. And so even though her and her family have those low filter in their fridge, because most people buy a fridge, it comes with it. It will show like it doesn't remove arsenic and uranium and nitrates and some other things like fluoride and stuff like that from the drinking water. And so it is helpful for certain people depending on what your levels are. So you can't just go buy a filter and say, oh, I buy this and it's clearing everything, like because you think it's it says clears contaminants. You really have to look at your report and then say, am I getting a filter? And when you look at things like reverse osmosis or the Berkey filters, those kind of things like that, one of them is gravity, one of them is putting through pressure, that you'll see is that it will remove all the heavy metals. Now, the microplastics, there is some problems now, even thinking of what the data will say is like maybe sometimes even some of these filters might even like the microplastics might be able to go through them, right? Just because they're nanoparticles, right? So it's like super small. So that is a concern, but we're trying to just decrease the overall burden and load. Again, the other thing is, so aside of getting clean water and filters, is not storing water in plastic bottles, right? So for every liter of water, there's 240,000 nanoparticles of plastic. And so, how many of all of us, which we're all guilty of, was we used to have bottled water. Or we go on vacation, or we're going. I go every time I go on a flight, I have to buy a bottle of water in the airport. Now I'm sitting there thinking, like, I'm not sure if I should do this. I'll bring my
Yeah.
glass bottle next time and
Uh,
fill it up.
Um,
Because some of the airports have those filters now. I don't know
yeah.
how good they are, but at least I'm not, sitting there on a plane going on a trip and drinking microplastic. But you have to look at the bioaccumulation of that over, decades or years. And when we see now, again, with that study showing in the endarterectomy, when people are looking at the plaque in our
Yeah,
artery,
that's what scared me when I heard
and
that.
and they showed 60% of those people had found under the microscope microplastic with these jagged edges, and that those people had 4.5 times higher rate of having a heart attack or stroke and death within I think is either 3 years of that. That's concerning because it's not just the cholesterol buildup and the inflammation that we always talk about, kind of lowering the overall vascular blood flow to the brain and to the heart and everywhere else. But now we're looking at a secondary agent that's from the environment that's actually embedded into that, that's causing even more of a risk factor because it has like a jagged edge. So that has a tendency to tear, as they were talking about in the studies. Now, that also might be contributing to more fatty liver issues aside of the diet. That might be also contributing to more what they call chronic kidney disease, which is something that when I was a resident didn't really exist, 25, 30 years ago. And now there's like a code and there's chronic kidney disease stage 1, stage 2, stage 3, stage 4. And this is just when people's filtration rate, they call it GFR, glomerular filtration rate. You have a BUN and creatinine on your complete metabolic panel or profile, and that's going to check your electrolytes and your kidney liver function. And the BUN is usually their hydration, and the creatinine is the kidney aspect, and you want that less than 1. Lesser the better. People who eat plant-based always have the lowest, by the way. That's why we're eating plant-based, because we're trying to preserve the high protein. Animal protein intake, causes stress on the kidneys, as we know, blood sugar, blood pressure, et cetera, et cetera. But we are now looking at that these potential particles of plastic might be affecting the tubules, the smaller little, filtration parts of our anatomy in our kidney, and that could be causing the slow decrease in function because we have a lot of patients that who are plant-based. So yes, they don't have all the diabetes, the heart disease, none of this is all reversed with diet, but sometimes their GFR is still kind of over time. Now because now this came up, I started looking at some of these patients, and it's like there's a little bit of a trend. It's trending down, but yet they don't have all the other what we consider conventional risk dietary lifestyle risk factors. But when you have to look at what the risk factor that everybody's still getting is, they'll come to my office for an appointment and they're carrying a bottle of water, or they go to the store and they fill out jugs of water in plastic. Everybody's using plastic. I go buy this brand or buying some type of water. So that's one thing. But when we look at then what do we do then after we filtrate it and try to clean out plastic, storing things in plastic? I just saw a YouTube video of this guy who I like, who was making Mexican food and tacos, and he was making this nice little taco bowl and all that. So I was like, oh, great idea. But I saw him like put the tortillas in a plastic bag and microwave it. So these are things that we don't realize, that people buy plastics, say frozen food. They tell you to slice a couple of holes in the top and then microwave that, right? And that steams. But all that steam is bringing all that microplastic back into the food. That's why we've been advocating for years, before even the study came out, was take out that plastic wrap, put it on a microwavable safe dish if you're microwaving, because every time it's sweating, just like with the popcorn, which everybody learned many years ago, like how dangerous, because that inner lining of plastic is actually it's kind of melting with the butter and the heat and the oil, and that's just all getting into popcorn. And there's a lot of studies showing that people would open the popcorn and get this kind of like, even the chemicals from that was dangerous to their lungs. And so going back to the old-fashioned way of using an air popper or cooking on a stove, kind of thing to do popcorn is way safer and better. But all these things that we don't think about. So it's not just the bottle of water that just got a lot of press, but we use plastic all the time. People use plastic wraps and plastic things, and they heat it. So that's just another way of expressing and extracting out more of those plastic particles than we need. So that's just cutting out, trying to cut out as much as you can from your environment. But once it's in the body, we would look at it the same way. Although, I don't have anything like specific, to help, like, well, how do you take out plastic? But we would look at the same way as we would look at any kind of heavy metal or any kind of other environmental toxin. Is like we have to strengthen the markers of detoxification. First and foremost is making sure that people have a whole food plant-based diet, that you're getting at least 30 grams or more fiber a day. Because fiber at the end of the day is what's help binding when the body's getting rid of everything and going into your GI tract. It binds toxins and take it out. Now, since most people are constipated, they're not getting enough animal protein, then just the toxicities of plastics and hormones and chemicals is just recycling. It's just hyper concentrating. It's called hepatic circulation. And so when it gets to the colon, it just recycles back through the liver. So that people have this chronic insult of inflammatory and chemical processes because they're not having normal bowel movements, 1 to 3 daily, well formed. And so having a diet's important. But then there's other things that we give. I mean, we have liver formulas that have the ingredients that will help improve detoxification. So glutathione, alpha lipoic, milk thistle, selenium, these kind of combinations. We have a liver formula and these kind of things, and Ayurvedic formulas that we have that are specifically for liver. These help actually improve the function of the liver. It actually helps I mean, we actually measure these in our patients. We can do the test where we actually measure your levels of alpha lipoic or glutathione, your detoxification markers, and it tells us, because not only just based on diet, do we need to augment something in the physiological system of the body to improve those functions? Because someone can have good bowel movements and still have poor detoxification, right? We just know that we just need to start priming up and improving all of these parameters. So there's a lot of things that we look at. Hydration is key, right? Because dehydration hyperconcentrates and stuff. So flushing out in the way, but there's not a single product, and I'm sure like in the next couple of weeks we'll see on social media everybody hawking some kind of like, this is going to take out your microplastic, or do this kind of cleanse, or a fast or something like that.
Right.
But we want to look at it as if you do the kind of things that are normal that we do with our patients, it should assist with that. But really the key, I think, right now, and first and foremost, is stop the intake as much as we can, because that's just for everybody in their family, because we're all drinking the water, we're all drinking something, we share things, we buy things.
Right. Right.
So I think going forward is like, well, how do we limit the further damage that might be coming in? And then how do we strengthen our physiological system that we have right now?
Right. So my question is, because this is along the same line. This
Yeah.
is my water bottle
Yeah.
I've been using. I started using it again when my glass bottle broke.
Yeah.
Do plastic water bottles like these still cause an issue?
I'm not sure about that. I think there's going to be different densities of plastic. So, for example, what I do know is that like single-use bottles are the worst, because single-use. So, someone goes to the store and they buy a bottle of water, right, just off the shelf, or they go to a restaurant, they're getting a bottle of water, whatever, airport or whatever. That's a single-use bottle, and so the studies did show that I have a lot of patients who are more conscious about recycling, so they actually will reuse, unfortunately, that single-use bottle. So I got someone, they'll come in and they'll be like a Fiji or, Evian, whatever it is, right? Like even just the cheap Dasani water, whatever. And they'll just keep reusing that plastic. They're like, oh, I just fill it up because I don't want to just use more bottles, right? I'll use it. But those single-use plastic bottles actually leach more microplastics because they're not made to hold, like, so your water bottle, your water container there, it may actually be less leaching because it's a harder plastic. There's different kind of grades of plastic as we get. And so you can see like the ones that you can easily crush, right? Because they're trying to save plastic, right? Those are usually single use, but a lot of times people reuse those, and that is a problem because we're actually they're actually leaching out more. So every time someone refills a plastic bottle, that's just kind of taking more of that plastic out. In those kind of water containers, though, I would actually contact the company and ask them that question, because I don't know.
Yeah.
There's probably different bottles. I don't have it with me because
Just use a stainless steel
I was
bottle.
just gonna say
stainless steel or glass. And now the
Glass.
glass bottles that they get, they usually have, like the ones I have like a little bit of rubber around it.
Mine did too, but they still broke.
Yeah, it can still break because it's but those are the things that now it's worth that a little extra. It's a little heavier. Yes, you got to make sure it doesn't bang everything, or get a stainless steel container. But those are really important now because every kid that goes to school and everybody's drinking water, which we want them to be hydrated, but to just get some kind of plastic and not think about it. And I'd probably be wary of some of the plastic water containers because it's just mass produced. It's cheap, right? So there'll probably be better grades of that and cheaper grades, but they all look the same. And so that would be something that I definitely would reach out to the company and say, hey, do you have anything to show that your water bottle is not leaching microplastics?
Yeah, that makes sense. Yeah.
Because again, I'm sure they can probably make something that is not so leachable, but as the industry, as would go, it's all about price and cheap and margin. So, that's, no one was talking about it or thinking about it before now. So I don't think they really like, oh, we're going to make the strongest plastic. They're going to say, well, what's the cheapest plastic that we can do? Yeah. I would just switch to glass and stainless steel. That would be the simplest thing to do.
I'm glad it's on our radar now. I mean, it's important to think about.
It's very important to think about, but it brings the idea that there's more. So like when I have patients coming in and they move plant-based, or we move them plant-based, but that's the first foundational step. But then we have to look at all these other things that, regardless of your diet, regardless of your politics, regardless of where you live, we're all getting exposure to like forever chemicals as well, right? Or now we know microplastics, and then you look at the water area. there's no place in America that is free without contaminants, but the contaminants vary between where you live, and also then the filters then vary on what they filter out. So we go that one step further, because aside of just moving towards an anti-inflammatory diet, we have to look at all these other lifestyle issues that are affecting Americans and people around the world.
Definitely. Suzanne, I don't know if you
Yeah,
have the questions open.
I do. Let's see. Can you share a few stories about some patients that you've helped? I know you have to change all the rules for like HIPAA things and stuff like that, but can you give us some like one of your star patients and
Well,
what
I'll give you a
the
few
whole process?
categories just because
Yeah.
that's like, so let's just talk about heart, because I'll talk about like one of my first like aha plant-based diet, because we
Mhm.
know my practice has shifted. Originally I was all predominantly primary care. So, diabetes, heart disease, obesity, depression, high blood pressure, those are the common things that, walked in the door. But unfortunately, in the last 15 years, there's been a huge shift to focusing on helping cancer patients, because the population and cancer now is like kind of this exponential 1 in 2 men, 1 in 3 women in their lifetime will have cancer. This wasn't there when I was a medical student. So it wasn't like, oh, I want to go in and kind of, this is a focus of where I'm going to be at. Just by default, through our successes as well and our approach, is that we have the longest surviving patients of all sorts of different types of cancers. And it's looking at this integrative approach. It's like, how do we use the best of everything, evidence space wise? But let's start out with heart disease. When I first went plant based, I read the China study. I took Colin Campbell's course way in the day when it wasn't even a CME course. It was just like, you can take it, and everybody's like, why would you take something you're not getting credit for? As a physician, people are like, why are you crazy? It's a couple of weeks course. I'm like, no, this is really interesting because the book was fantastic. But for me, like, I'm an evidence guy, so I want to go read the data. I'm a little bit of a nerd that way, so I wanted to get a deep dive, and so I took the course and all. It really was transformational because like it speaks loudly. I mean, the book is nice because it's for the layperson. You can read it. It's going to tell you like all these wonderful things. Wow, this is why you should do it. But when you actually get into reading the volumes of stuff which they showed through the course, it was like there was no denying the data. You had to follow it. And so even though it was at that time I was more Mediterranean vegetarian, way back then in 2015, 2014, and then by 2016 I was like, after I finished the course and everything, I was like, I'm done. Like, it was just like, by the time I finished the course, I was like, there's no reason. I couldn't even justify to myself. Like, the risk is like, it's like so clear. And so when we switched, I had this lady who came into my office, and she was a single mom. She was in her early 50s, and interesting, she had a high stress job, and karmically, interestingly, more enough, is that she actually worked for a food service company, like one of these big. There's only like 2 or 3 big distributors. Like, they come to the hospitals, they come to the schools.
Yeah.
You see the trucks all the time right in the neighborhood, like, oh, we deliver food to America. And so and this is in retrospect, this is the perspective, right? Because you don't even think of these things at the time. And so she came to me, and it was very interesting because she wasn't like interested in integrative medicine or anything like that. And she's like, oh, I heard you've helped so many people, and you're the guy to go to because you kind of understand both Western medicine. You're an MD, and you do a lot of the natural medicines. You're a fellow with Andrew Weil, blah blah blah. Okay, great. She's like, well, I have a dilemma. I go, what's the dilemma? And she's like, well, I have really bad heart disease. I go, okay. And she's like, and I'm scheduled for a heart transplant. I was like, okay. And then she says, but I had a dream that I died on the table.
Oh my God.
Wow. Wow.
And I was like, wow. Because we do know, right? And there's all sorts of studies to show that. But we do know that, the patient's belief. That's why it's diet, lifestyle, environment, and belief system. That's the epigenetics I talked about last time. That's what I talk about in my book. Is a shameless plug always, but
Yeah, no, it's an awesome book though.
Because epigenetics, I mean, on my next edition, and I'm really going to get into more detail of that, because the belief system of the patient is super key. And so when someone believes something, it actually can supersede the total outcome. So we have studies, for example, if someone goes in and to see a doctor, and say their surgeon is an A+ surgeon, okay, like, oh, they went to Harvard and they got all this rank, best doctor, blah blah blah. But the patient's perception is that they're a C+ surgeon, right? Because they were a little bit arrogant, and they were, like, they didn't treat them with respect, and they're a little bit, cocky and all this stuff like that. Their outcome will actually be C driven. Okay.
Wow.
And vice versa. If someone comes in and the ranking of their surgeon, say, for example, is a C, like, they're okay. They're kind of an average doc, didn't do so great, but they come in, they treat the person with respect, and the patient likes them. They go, oh, they totally get me. They are listening to me and all, and they think they're an A. They actually have a better outcome. They got an A outcome. So we know that belief system is huge in that. So when someone says, like, I died on the table,
Yeah.
That's a huge, like, so he's like, okay, well, I can send you to Cleveland Clinic, the top heart hospital, the top heart hospitals in America that do heart transplants and stuff like that. But if the patient's belief system is so strong, it can counteract the best surgeon and the best medical team, right?
I
So I was like,
totally
okay,
agree with
we have an issue here. Like, not that you're putting the pressure on me, but we have an issue here. So I told her, like, hey, I just finished this course. I just finished this. I actually transitioned myself, and I explained all the data. She had no other choice. She's like, well, she had full vessel disease of her heart, so she can't get a stent. She can't take the meds because it's just like, we just got to take the whole thing out, put a new one in. Okay, so
Wow.
she's past that point of like, oh, we can bypass or
Wow.
we can. It's just full vessel disease. You're on the heart transplant list. She's like, I think I'm gonna die. So I'm like, okay, well, what we can do with the data set, and I remember the videos, and I remember the movie, Forks Over Knives, and all these other things.
Yep.
And I did, was able to meet with Esselstyn, at a conference and stuff like that. He shared his stories. So I said, okay, look, if we do this, we could do this strictly. And she's like, I'm a single mom. I don't have much money, so I don't want to buy products. I don't want to even buy supplements. I want to do everything by diet because I have to buy food anyway. So I'm like, okay, let's just, let's focus on plant-based diet. So we focused, but we do the same thing with her as we do with every single patient. We always look at what foods are triggering her inflammation. So we look at sensitivities. That's one of my specialties, right? So even as we transition to a plant-based diet, 100%, we want to look at, of all the plant foods, is any of those foods causing inflammation, either immediately or delayed, or does she have gluten issues or other aspects? Because food is going to be medicine at the end of the day. And we want to make sure that she's eating something that's an anti-inflammatory food rather than a pro-inflammatory food. However, we do that. We look at our microbiome, right? Because that's important. We look at all her nutrients and toxicities, deficiencies, so we can lean to tell her what to eat more of, or how to focus on, or what we need to help, with elimination and detoxification. But she did that, and an interesting thing is she did it really strictly, because she was like, I'm not gonna. I was like, I can give you some natural things to help lower lipids. I can give you natural things. She's like, no, I want to just do diet. And I was like, great, I'm all for that. Like, food is medicine. I love that. But most people need a little help because it takes them a little bit longer, because most people are not on that fast timeline of like, I have a heart attack. Like, I can just do it over time. So and we hold our patients' hands, and we take them through the slow transition, because everybody, you have to meet them where they're at, and what their skill of cooking and learning and education and just and commitment. So hers was like now, because I'm on a timeline. And so in fact, it took us about six months. So in 6 months, because she was doing everything like we would check her. She went back, she gets the angiogram, complete reversal of all vessels. She's off the heart transplant list.
I love that.
Now,
That's
interesting
great.
thing is, like, even for me at that time, now it's like no big deal. Like now it's like, oh yeah, we can reverse heart disease, no big deal. But at that time, it was like a hallelujah. Everybody stand up and say hallelujah, because I was like, because you hear these things, but until you actually experience your own patient, that here's your angiogram, which is all clogged, and you're on a heart transplant list, and now like you got flow and everything is better. It kind of proved what we've seen, what we've read, but it's, proof is in the pudding when you have that experience. Anyways, she changes her whole lifestyle. So on top of that, like, she left her job, she became an artist, she all these things, because like there's things that become more important to you, right? As we all face this health crisis. And it's fantastic. She's doing perfectly well today, just on a completely different trajectory of where was she going. But understanding that food was everything. And even for me, that acceleration that fast, because I was like, oh, it's going to take at least a year and all. Now, at that time, it was really good, because she's from a small, like, in our town, we have like different communities, and some of the communities are like really old, like culture, like families go back generations and generations. Like, we have it's New Mexico is this wonderful melting pot of different cultures. But where you live in the town of New Mexico also has its own heritage, and like there's families that have been there for hundreds of years, like in certain areas. And so she was very well known, because she's in this area, and everybody was shocked, because it's like, when we hear like conventional medicine and heart disease, and like that's like scary for most people, which it is scary even for us. And anyways, it was like she was like the talk of the town. Everybody was happy, everybody got excited. She's got a new set on life. And then I get a little bit of, so when you asked me that question last week, do you ever get backlash? So that was the time I did get backlash. And the reason being, so I actually got communication back, because every time we have someone on heart transplant, I forget the numbers, but it's like, I don't know, 500,000 or whatever, all this, the surgeon, the this, the that, the rehab, the post, the drugs, the this, the that. There's allocation of that per patient, per admission, and all this stuff. And so there was just like this whole like, shame on you for preventing us from doing this job. And I'm like, they should have been asking, like, what are you doing to help these people? Because not everybody can get a heart transplant. Not everybody has insurance to cover a heart transplant, and not everybody can find a match in time to get a heart transplant, for example. So it was a very weird time for me at that time, because it was like, this is weird, because like they should be like, hey doctor, what are you doing here? And maybe we should have a program. But this explains why, like, even when Esselstyn, and I like to use his example, because when he was originally at Cleveland Clinic and he started doing this integrative stuff, like using more, dietary life, not necessarily fully integrative, but the diet was a predominant thing. Eventually, they moved him off campus. So like their whole clinic now is not in the main heart of Cleveland Clinic, because they don't want someone to happen to go in there first before they go to the rest of the facility. Is you go through all of this stuff, you get your heart transplant, to bypass this, that you fail because no one's telling them how to change their lifestyle and diet, unfortunately, right? They did a great job. I mean, they're number one at, so I send all my patients who have heart, go there. They got a valve replacement. They're the best people. But what happens then, that you don't see Dr. E, as they call it, like until later. And I didn't, I was like, well, that's just an odd, peculiar thing. And then I realized, like, once I experienced that, it's like, yeah, we've built a sick care system rather than a preventative care system. And it's the money's over there, the money's not over here. And that's just what it is. So it's not that they're bad doctors. They just built a system that they have to keep it running. So the pressure is like, we got to keep it running. And as time goes on, and people are now shifting over, and there's so much now resources to help reverse heart disease, it's a quandary of seeing, cardiology, because cardiologists should be focusing on the prevention and reversal of heart disease rather than the treatment. But the money is not there yet. Now, some states, I think there's like 35, 36 states, like with Blue Cross, covers like a Dean Ornish program, right? So like people now, if they have the right insurance and they have this thing, they qualify, it's paid for by the insurance to go to a Dean Ornish program, right? Which is like, he's the father of reversing heart disease cardiology wise, plant-based. Wonderful books. You can always look up him. But it's just like, well, now they can do it because it's cheaper to go through like a $5,000 program than a $50,000 or $100,000 or $200,000 procedure, and the risk is less. And even when those people go through those programs, if they're not 100%, because not everybody's going to come out to be complete, but if they stop smoking, they exercise, they have some stress reduction, and then they even reduce their animal intake, even partially, their morbidity, mortality drops significantly. Like, it's so much worth it. So it's not like everybody's going to be 100% whole food, plant-based, and doing everything that we want them to do. Those who do, even better, by the way. But those who don't, it's still a huge, like, a shift, because what people don't realize is that you don't have to be 100% of everything. It's about lowering all your risk. That's why I'm a risk reductionist, not a perfectionist, because we see that once you start affecting your epigenetics, the outcomes shift significantly. And so that's heart disease. So that's one thing that, I was surprised, heart disease. The second one is looking at diabetes, because we know that some heart disease, we can easily reverse diabetes, type 2. So most people come in, they have diabetes, long-standing, insulin resistance gets worse. Okay, I'm on metformin, I'm on glipizide, and blah, blah, blah. Now they have all these injectable form drugs. And so those are cases where I see every day, because that's something like, you just get all the inflammation, you change their diet, you find these triggers, same thing like we did the heart disease, then they're able to wean off their medications. But I had a patient, this is shortly after this other heart disease patient, about a year later, who was in his early 40s. And he worked as he worked in the special military units, like a SWAT.
Yeah.
So these are like, I don't know what you call them, but I call them SWAT, because that's what I remember as a kid watching television, and I haven't been in that world since. So I don't know what they call them now. But, this is a very dangerous kind of thing. They come in, they're wearing the gear, they got to bust down drug dealers and, gang members. And so there's, fighting and shooting. And it's a very, it's like a special ops kind of group. But he is type 1 diabetic. Okay. Which is very interesting, because I'm like, wow. So he's early 40s, and since the age of like 5 or 6, he was type 1, and he gives himself insulin shots, and is, and so he came in from some other things, because everybody has issues. So I was like, okay, but the diabetes in his mind was like, okay, I want to fix everything else, but I'm like this. I was born this way, and lo and behold, like, I could be the same thing, like find your microbiome, stress, this, that, do all the epigenetic testing and all. And he was able to wean off of insulin. Now, again, at that time, I was like, this is not possible, because you're type 1 since age 6, like that. Yeah. But now, if you look at plant-based diets, and you look at, there's even programs now from type 1 diabetics. There's a couple of PhD doctors and stuff. You'll see it on the internet now. And they're at the plant-based conferences now. They have full programs like for just diabetics from the diabetic. So like I can treat diabetics, but there's some people who've been type 1, like they've been injecting insulin as well.
Are you
And
talking
so
about like Cyrus Kumbada?
yeah,
Are
it's
you
like
talking about,
Cyrus, right? Yeah. So there's a lot
yeah.
of people like that,
Still
right?
takes
And
insulin. He just takes a very reduced
very
amount.
little dose, right?
Very,
And
very
so
little.
some people can get off completely.
Wow.
But for most people that we have who have been type 1, especially children and all, it's about a 95% reduction in their insulin intake, which is
Yeah.
fantastic because most
It
people,
is.
it burns it out, right? Like they're on an insulin pump and they get higher doses, and it's not really helping, so the lower the dose of anything, of any drug or supplement, that's the
Wow.
right dose if you get the physiological control. But for us, it was fantastic. Now, he was really
That's
good.
amazing.
He was really good in shape, but his challenge was that he had to be really careful because in that situations, the blood controls, your
Yeah.
adrenaline, your stress hormones, so that to me, I was really nervous because I'm like, wow, I can't even believe you're even doing such a job that can make your blood sugar, because just talking about it, my blood sugar was going up and down. He's telling me what he does. I'm like, wow, I'm so glad I sit in an office. But thank you for your service.
Yeah.
But it shows you like the power of diet. And for him, it was
Amazing.
very interesting because he became similar to Rip Esselstyn, who was a firefighter of son,
Yeah.
right? And then you get your whole unit to change, because he was like the leader in the group. He was able to change his whole unit.
Wow.
Because it's
Awesome.
like, there's all like camaraderie, which is great. Like you
Yeah.
always want someone who may have a little bit of a challenge physiologically or metabolically in this case, or, something like that. It's like, it's a brotherhood, right? Like your police officers, firefighters, army, military. It's like we're covering each other's back. So we want the best. So it's kind of interesting. Just like it was nice because later on, when Rip, came out with his story and they showed all the firefighter stuff like that, it just reminded me like this is a good thing because you're trying to lead by example. You're not trying to like
Exactly.
force people to do something, but when people go, oh my God, you did this, and you were like, we see you have to do this right before you bust in the door, and all this stuff, measure all this stuff, and then go in, and now you don't have to do that. Like that's really cool. That's a huge life-changing experience, and so that was a kind of another moment in my practice. I was like, what?
Wow.
Because
Yeah.
you type 2 is yeah, type 2, you type 2, but type
That's
1 is
amazing.
like that's really, and especially of this kind of high caliber. And so again, it's always about expanding what and going further, right? So it's like, because conventional medicine, like, it's stuck, you'll never change. You got this disease.
Yeah.
The third one would be when we look at autoimmune diseases. I'll do 4 actually, but autoimmune diseases. So, since it's all about inflammation, the key is just underlying finding those triggers. And so we get people all the time with MS, with lupus. Here in New Mexico, when you have a diagnosis with lupus, it's like a very scary thing because culturally here, it's things that it's like the chupacabra. Like everybody's worried about. You say the word lupus, it's like it's a scary. It's an amorphous. Nobody understands it. It just sounds like this terrible disease. But we have people,
they try to diagnose me with.
yeah,
Lupus.
and
I'm like, no.
most of these autoimmune diseases, it's a now they call it like a multifactorial condition. So
Yeah.
people can have like rheumatoid, lupus, this and that, and they just start putting a dash in between each name because it's the fire in one part of the body, central nervous system, or your kidneys or your joints. Then eventually, it just keeps burning. If you don't stop the fire, it just starts to spread to other places in the body. So we have people all the time who come in, and I had this one lady who came in, and she worked for a television company. She was like a producer, high stress, so it's like like television, live television, da 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 da. And she moved from here to with the state where the show was. It's a national, international thing. So she was on the back end. She's like head of the programming. Stuff like a lot of stress. And so again, she had lupus, and she ended up going to one of the top centers in California, Scripps, which is a great, fantastic medical center, and it was followed for lupus. And then she came back here because she's locally from here, living here with family. And I said, hey, she came to see me for other things. I said, hey, we can reverse your autoimmune. We do it all the time with rheumatoid and with this and that. And she had all the labs, all the numbers, all the issues, and they wanted to do infusions, and she's like, I don't want to take medicines. Every time she tried the medicines, even though she wanted to, she was someone who was very sensitive. And later on we found out that there's like methylation, there's detoxification, genetic expression issues where they can have a higher rate of side effects with certain type of medication. So it makes it difficult for those people who even want to take a medicine or try, like, hey, I'm not against pharma, I just keep on getting side effects. Every time I take something, I'm the one who's pulling out the list saying I got this. So again, looking at the inflammatory foods, looking at the microbiome, looking at nutrition toxicities, deficiencies, those kind of things, stress reduction. And then for her, it was about 8 months, complete reduction of all her lupus numbers, all her
Awesome.
autoimmune numbers, all her inflammatory markers. And now even today, which is now, I don't know, I think it's like 12 years or something like she goes, and she still, she goes there, goes to the scripts every 6 months for her checkup. And they're like, just continue doing what you're doing. No one's really asking, what are you doing? That's the only caveat, as I said.
When I reversed my lupus symptoms,
yeah,
they said, I said, do you think it was the diet? And they were like, oh no, not a chance.
Yeah, they would never admit that.
Yeah. And remember, like I mentioned before, the definition of, but per FDA, is like the only thing that's preventing, treating, and reversing a disease is a drug. So by that definition, our whole system, like anything that you do, doesn't count.
That's
anything
what
you put in your body doesn't count. It's the only anything that's prescribed that counts. And that's the problem, right? So just by that definition, by default, they're like, no, it's not. It wasn't your diet. It wasn't your lifestyle. It wasn't how you were thinking. It wasn't what you were doing positively, which even all the preponderance of data will show you that's what it is. Just by like they set the definition. Hopefully in time, we eventually will start changing some of these definitions.
I hope so.
That will change the mindset. And then the last groups of people, since cancer is kind of the area that I've been focusing on, 60% of our practice now is cancer patients or more from all over the country, all over the world now, because we do telehealth all over. So, I'm a consultant, so I'm not their primary, I'm not their doc. I just we review their labs, we review their history, we go through, but I spend 2-3 hours with the patient. So that's the difference between a 7 to 10 minute, appointment with an oncologist and spending 2 hours, 3 hours going through all your labs, your medicines, your supplements, your diet, your lifestyle, stress, epigenetic factors, and then kind of gearing people of like, how do we move them as quick as possible where they're at? Because everybody, again, is at a different place. Some people I see are really young, they're in their 30s and they have cancer. And now some people who are in their, so the guy the other day, 87, right? And so everybody still wants to get better. Everybody's tired of side effects, or I have a lot of people who are in treatment and they're tired of recurrence. So I had a patient, now she's, I think 7 or 8 years out. So she was on her third recurrence of breast cancer and second recurrence of thyroid cancer. Wow. So she has two different cancers, right? And they drove all the way down from another state, her and her husband, and it was really fantastic because her husband was super supportive. And I think when anybody has a chronic condition or chronic health issue, it's really about support. If you have your community, you have tribe, you have someone who can go through that journey with you, it just makes it so much easier, because there's times that, people, especially if they're getting treatment like chemo or this, that, it can feel terrible. And without that support, a lot of people kind of have difficulty getting as much success.
You have a reason to live,
You need, and it's, it takes a village, I would say, right? Like I'm an integrative doctor, so we use a whole team approach, and even it's not disbanding or discarding their own practitioners. It's like we keep them in the loop, or we're part of their team. Whether they understand what we do, that's another issue. But it's about bringing this whole like collective to help the journey of the patient's health. But when they came to my office, they were like, "Doc, I think something is off." It's like I'm on this is my third recurrence of breast, my second recurrence of thyroid cancer. And I was like, well, it's because you haven't done any of these other things. Now, not that they were doing anything wrong. They were doing everything their doctors told them. They showed up for treatment. They did surgery. They did chemo. They did radiation. They get all the screening and all that stuff, and then comes back. And then, they go through treatment again. And then
frustrating,
all that stuff. And so they're the most compliant patient, right? Because they did everything that they were supposed to do. And I was like, but because the system has failed on telling them what they need to do to prevent, you have to change all those epigenetics. Again, diet, lifestyle, environment, belief system, everything that set them up to get the cancer and all these multifactorial things. You have to like reestablish it, rechange that direction of how the DNA and RNA encode in real time. And that's the epigenetic changes. Once they did that, same things as we mentioned before, then no more recurrence. Like it shrunk, it went away. The cancer's not, because they were at this time, they were really hesitant at going for, like, this is the third round. You're like, I'm not sure about this approach, And for me, like anytime we start seeing something, we still follow with our oncologists, scans and PET scans, CT scans, biopsies, ultrasound, circulating tumor cell tests, any kind of genetic, like we're following cancer markers and all. So it's not like, oh, you just do this. It's like, no, we have to follow. If it's not responding, we got to change course of action, or we got to add something else, so it's not like a set and done, like one shot fits all. Everybody's, even with breast cancer, for example, I will see there's a certain amount of things that is similar, And there's a certain amount that based on their other labs, their microbiome, their nutrition, their detoxification, their, their diet, their access, their education, their ability, that changes also how we have to custom tailor the recommendations. And that's the uniqueness that we are able to provide, because that's giving people individual medicine versus like, okay, you just show up and everybody gets the same IV and everybody gets the same thing. We have to custom tailor because how you lower the side effects of those treatments. So now she's fantastic. Everything is great, but it shows you that people can also have multiple problems, right? Like 2 different types of cancer. And it's not like the same thing that we get for one is for the same for other. Whether it's an estrogen positive, whether it's a triple negative breast cancer, whether it's colon to metastasis, all those things change. But when we look at evidence-based parameters, we just look at what's in vivo and what's in vitro, like what's in a cell culture, what's in an animal. In best case scenarios, we have what has been shown in human patients in clinical trials and studies showing like what are the natural agents that are used that can affect cancer cell metabolism and slow that down. It's not chemotherapy. Right. But the challenge right now with alternative medicine, everybody wants to run all the way to the other side from this side to this side. And then they want to just jump with belief that all these things that they hear on the internet or whatever it is, marketing, is that that's going to be a natural chemo. It's like, but it's not. You have to look at all the evidence. And a lot of patients who come see me are taking things that are not at all specific to their cancer. So it's like, oh, it sounded good. I read this on TikTok and, I saw this. So remember, TikTok is the #1 source of health information now for the US.
No wonder they want to shut down, huh?
Yeah. So more people will go to TikTok for cancer, for heart disease, for diabetes, than Facebook, than Google, than WebMD. So
wow.
This is an issue because in a 10-second, 15-second video, people are making life decisions by someone who knows what they're selling us. And that's why I'm telling you right now that we're marking this date of this podcast. We'll probably see in the next month something for plastic
microplastics.
Microplastic, do this, do that, and people will buy it because in 10 seconds that's kind of been our
bottle.
So when we look at patients, it's funny because as simple as something would be like say blood pressure or depression, anxiety, to something as serious as cancer, autoimmune, it's the funny thing is everybody thinks it's so complicated. And what makes the complications that some people have more problems. So it's it's layers on layers. Like, okay, I got heart disease, I got diabetes, I got high blood pressure, I'm obese, I got depression, I got arthritis, and I have now colon cancer or prostate cancer or lung cancer, right? So that's layers, because for them it's like, well, we're learning a lot of things at one time. For me it's easy, but for the patients, like, wow, that's a lot of information. But it's like, if you want to get better, that's what you got to do. If you want to get a gold at the Olympics, you got to train for it. And I always tell my patients, I'm very upfront, I only go for gold. I don't go for silver or bronze.
That's good.
Because the idea is like, you never want to just go there partly and then not go all the way. Nobody remembers I don't remember a bronze or silver anybody, unfortunately, even though they're all great athletes. Don't get me wrong. Okay. But we all remember the gold athlete because that's what they go for, right? It's like, that's who we remember. And so when people go to reverse their heart disease, to me, it's not just reversing the heart disease, it's going through their checklist of all their diseases and go to the next one. And go to this. So once, okay, my cancer's in remission. Okay, but we still got to get the heart disease under control. We still got to get the diabetes under control. Yeah. We got to keep going because that's the whole optimization. The problem is people singly go to one thing, and then they say, "Oh, I got rid of the worst thing," and then they die from the next thing.
Right. It's about optimal health.
Really. Optimum health, right?
Yeah.
And again, it doesn't have to be 100% of everything because it's all about risk reduction. So the benefit to our patients, like if I get their lipids down and they're normal, and they're not fully plant-based, would it be best for them to go plant-based? 100%. Okay. Yeah. Am I going to shame them or blame them? Absolutely not. There's other things to work on.
Yeah.
So the idea is that it's reducing this, and that gives a huge relief to most of my patients because some of them they just can't for whatever reason, right? And I'm not here to push that. It's like, look, if I got your risk low, that's not your problem anymore. I'm not here to that's good. Next, what's the next thing? So that's where we focus on. And I know a lot of plant-based practitioners and programs are very, very strict. It's like my way
or the highway. Yeah.
Really extreme on those kind of things. And for us, it's like, we want to look at the totality, like where's the patient doing? I always recommend all the patients. And this is where I think sometimes with plant-based doctors is that they say just eat more plants, but like, how do we know that their nutrition is good unless you test it? Right? You can't just assume that just because you're eating a whole food plant-based diet, that your optimum nutrition is there. You're getting foods that have optimum nutritional density. Don't get me wrong, but whether that patient is assimilating that, your microbiome's different. My tomato, where your tomato, the amount of lycopene that varies, right? So the idea is that we have to measure, just like we're measuring cholesterol and thyroid and blood pressure and kidney and liver and all these other things, we have to look at it the individual, because then we can kind of tailor, like, hey, you might need to eat more of these foods that have vitamin B6 in there, or vitamin A, or zinc, or molybdenum, whatever it is. But we wouldn't know unless we test, right?
Yeah.
But a lot of plant-based doctors are afraid to look.
Oh, or they don't know how to.
Well, it's because, it's like, this is our shtick. We go and that's it. But, you can't just be like, like if you're doing physical therapy, you can't just say, well, just, do the exercises or do the things that I tell you. It's like, well, they got to be eating right to have the exercise to better. They got to be sleeping right to have the energy to do that. So there's a whole other thing that you would give them, which I'm sure you do, that helps the exercise or the physical therapy. But a lot of people are like, this is what I do, that's what I do, that's what I do. And I'm like, we need to be looking at a full holistic integrative approach.
Yeah, what I always tell my patients when they come see me, what I always tell them is, do you want me to like fix the whole thing, or do you want me to help you fix the whole thing, or do you just want to make your back feel better for a couple months?
Right. And some people will choose just the back, for a couple months. And then that's kind of hard for us, because like, okay. But I always let the choice for the patient, because at the end of the day, their symptoms or their disease or disease is theirs. It's not mine.
Yeah, they're the ones that
they own
it.
it. So it's like, if you don't want to have back pain, you're gonna say, well, I think you should not have back pain. Plus, you should also have these things, improvements of your life. It's your choice. But that's the thing I think a lot of people just don't look at, is the integration and looking at evidence-based. A lot of people say, don't take anything, natural. There's a lot of bad things, as we talked about last time, with products and safety and purity, efficacy every day. But when you have the skill and experience of understanding like how to find the right product, the right potency, the right efficacy, the right safety, the right manufacturing of something, then we would use it just like we would use any other type of drug or anything else.
Yeah, amazing.
I'm sorry.
I'm sorry.
Oh yeah, Dr. Pai, you were talking about belief system. This kind of leads into the next question, and I do believe what you're saying there, because I my own attitude, my dad would say to me, he loves to say, well, wait till you get to be my age. And to me, that's like something I want to prove him wrong. Wherever he is, if he's watching down or whatever, I just want to prove him wrong, that when I'm his age, I'm in optimal health. And I have that belief system, and that my goal is health. So my question is, I have issues with my knee. It's sort of chronic, but it's better now. And I haven't had swelling in years, and I credit the Bosmeric with helping that too.
Right.
But my question is, for other people who have similar joint issues, can they stop further damage from happening as long as they stick with a healthy routine?
Oh yeah, absolutely, yes.
Yeah.
So you can always stop the progression of disease. The challenge that we have right now in integrative medicine, and conventional medicine has no answer for this, is that what do we do once it's stopped, right? Because we need to help improve function, right? So physical therapy, getting the BMI correct, because the obesity issue with everybody in America right now is pretty much another issue with weight bearing on the joints. Getting off the NSAIDs, which I mentioned in the last issue, right? Because those are things.
I've never taken one.
Yeah,
actually.
And so now that the progression is stopped, and that's why. So here's the challenge, and that's an honest to say about when we see, say, patients with rheumatoid, because they might have disfiguration by the time they see me, right? They have they have disfiguration of their joints. We can stop their joints from flaring and lower their pain and lower the progression of the disease, but I can't fix the destruction of the joint, because that's damage that's already happened. Right. So if we can get patients earlier, and that's the challenge, because everybody goes, oh, I went to the best rheumatologist, and say, 6 years, 8 years later, 10 years later, it's like, well, I'm still rheumatoid, because it's never looking at what are the triggers that are causing the progression of disease. It just treats symptoms. So in this case, what we want to do, if we can get people earlier, better. But now then, from an integrative perspective, because from a conventional perspective, they'll look at, well, hey, maybe we can do knee replacement, right? Mm-hmm. So like if there's bone on bone, we're already past the point, then surgery is probably an option. But what we like to do is, even if people have to do surgery of any kind or any kind of intervention, whether it's even stem cell injections that some people get through orthopedics, or hyaluronic acid injections, or there's all these new kind of treatments to help the joint. Even what we do in our practice.
I did have a PRP.
Yeah, so
which,
PRP, any of these things, right?
a
So
few
the
years
goal
ago.
is
Yeah.
that in most cases, they will work temporarily and then they don't work as well. So like, so some people are like, oh my God, I got it and it lasted a year. I feel fantastic. And then I go back for re-injections or whatever, right? And some people will say, I got it and it only lasted 3 weeks or a month or 2 months or 3 months and it helped, but then it worn off. Because what we have to look at is that if there's inflammation in the joint, which there is, and think of it like a home and there's a fire in the home, well, we take out the previous tenants and then we put some new tenants in. Eventually those new tenants will burn if we didn't stop the fire in the home. So where we work with our patients, because a lot of patients come here to see me, or we do it online, you do telehealth, and they go to all these centers because they're in big cities usually, where they have like PRP, stem cell, whatever. And there's probably different things that are out there now for rejuvenation of the joint, the cartilage of the joint and those things. But they don't last long. So I have patients that, oh, I've done it and it just doesn't seem to last long. They get relief, it doesn't last long. And it's like, it's all out of pocket. It's very expensive.
It is, yeah.
So it's like thousands, depending on where you go, thousands of dollars and this and that. And there's different techniques, and someone say this is better than that. To me, it doesn't matter. What we have to do is we have to look at all these other things that we do with everybody, right? Like if you find your inflammatory triggers, even if you're on a plant-based diet, if you find all these other deficiencies or toxicities or anything wrong with the microbiome and you fix it, then those new tenants that go into the joint live longer and work better. And all of a sudden, the next go round when they do that, they're like, oh my God, I had 2 years benefit of this, or it's continuing permanently, right? So the idea is that we're trying to synergize. We have to get the patient healthy for any treatment, even when they go for cancer treatments, if we have time. And most patients, we have time, which is good. It's not an emergency. Like, oh yeah, it's scheduled in 3 months for me to do this and this and this. So it's like we have time to get the physiology, the anatomy, the immunology, all these things strengthened, tonified, stronger, so that the response to any treatment or intervention is always better. We just can't rely it on those people. So yes, we even use like something called rejoint. It's actually a patented peptide that actually goes into the cartilage and improves cartilage function 20-30%. Now it's not 50%, not 100%, but for most people, getting a little bit improvement of that regeneration of that tissue from something orally, 20-30% gets a lot of people
that's oral, huh?
out of the pain. Now I'm not against any kind of injections or this and that, but when people do that and it doesn't last as long as they advertise, it's not the fault of the injector or the product per se. It's that we have to strengthen the body's individual to have
put the fire
utilization of that. Just like the patient, go through cancer, they go repeat and recurrence. Like they haven't fixed the system that would keep changing. And if we fix the foundations, then it will last longer. But remember, when we look at genetics, to talk to you and your, how you are being with your dad, like your dad, is that 97% of all disease is not genetically related, right? It's only 2 to 3%. Even though we think about it every day, like breast cancers and all these genetic issues and heart disease and diabetes. I had a patient yesterday like, oh, diabetes runs in my family, my aunt, my uncle, I was like, no, what runs in your family is the lifestyle.
Yes. Yeah.
Right. Because so it's not that there's a diabetes gene that's like passing down or heart disease passing down. It's just that there's like, beef, chicken, pork, dairy, this, whatever we're eating. And now worldwide, our epigenetics is the same because we're eating the standard American diet. So if I go to Bombay, they're eating McDonald's and Pizza Hut and KFC and stuff like that. So all our epigenetics is kind of the same because we're all getting exposed to the same thing.
So
it's not
true.
like, oh, I live in Okinawa, I live in Costa Rica, the blue zones, whatever. But we have to look at the blue zones. Like they're not looking at genetics. They're not looking at the lifestyle, and the diet is key. And so we've been programmed though, like these are running our family, but what's running in the family is the lifestyle. Whatever our parents taught us, we teach our kids, for good or bad, right? And most of us now, unfortunately, are taught all the same things because it's just marketing from media and store and now social media. And so it's confusing because everybody now gets the same message. And that's why the disease is prevalent across all generations, where previous generations didn't even have that disease.
Yeah. Crazy. It's absolutely crazy.
Yeah. Suzanne, I think you have another question.
I did. Can you tell us like what made you decide to want to go into medicine in the first place? What made you want to be a doctor?
Wow. Lots of story. Well, a couple of things. I grew up in a family where my grandparents, I was lucky enough, my parents are first generation. I'm first generation born here. Parents came as immigrants in the 60s. My dad's an ENT, retired. ear, nose, and throat, head and neck,
Yep.
otology, head and neck surgeon, all that stuff. Mass eye and ear trained, Brown and Tufts fellowship trained.
Wow. Very nice.
So like super guy. And when we came, eventually they settled in a small town in Las Cruces, New Mexico, which is the southern half of the state, kind of near El Paso, Texas, so really close to the border of New Mexico. And he was the only ENT there for like 350 miles for decades. And so by the time he retired, he treated 350,000 patients over 53 years. So like almost 1 in 4 people in my state have seen my father.
Everybody knew him.
Along, right? But
no pressure. No pressure.
Yeah, no pressure. But my family actually in India, we come from a lineage of educators. And so we've developed hospitals and educational systems in India. So like medical schools, law schools, business schools, and those kind of things. So it's for decades, like for generations, going back way back when, because that's part of our whole concept, which is kind of like in my blood, is education is empowerment.
It is.
And if you, and that's why like in India, so a lot of people say like, well, gosh, why in China and India and Africa, they're so strict, like they do all their homework, they do, because the only way to get out of poverty, the only way to get out of inequity and inequality is through education, right? The problem is in America is that there's been a systematic dumbing down, as I think, over generations, because because if you're not really well educated, then we're easily consumable people. Like we buy things that we don't think about. We buy things, we chase the fancy laser light like a cat. And so on these other countries, it's it's the reason why is because they understand that's the only way we can get out of the situation we're at is by having education and empowerment. So it's kind of in our blood. But the turning point, there's a couple of turning points. But when I was a young child, my grandparents, I was lucky enough that they lived with us. And at that time, it wasn't until I did my fellowship with Andrew Weil, and this is 24 years ago. I was in one of the first classes of the fellows there at the Program of Integrative Medicine, is that my grandparents were strongly into Ayurvedic medicine, which is the traditional medicine of India that is still practiced today. And it's a whole system of medicine. Like actually my partner, Maureen Sutton, she's a doctor of Ayurvedic medicine in my practice. So people want to ever do a telehealth or come here and do an Ayurvedic consultation, you can see her. But they used to do like all these things in the home, like yoga, meditation, mindfulness. They used to use all these remedies. But at that time, it wasn't until I was in my fellowship, because I grew up in a town where there was very few Indian people, meaning Indian American people. Most people thought, like in my school, that I was either Spanish or Native American. Okay, that's just because I was a rare person to be, like not until my 12th year in school, there was another Indian kid. So there's kind of like, no one ever saw one of my kind, right? And I never saw one of my kind also, to be fair. So I was like, everybody treated me like their own. So it was a great kind of, and that's how our community is. So we're really encompassing, really like everybody's family.
Yes.
But it wasn't until I was in my fellowship where we started to actually explore Ayurvedic medicine. And then when I studied with Deepak Chopra, and that's where I met my partner, Maureen, who used to run the Chopra Center for 6 years with Deepak, and then going to India and study Ayurvedic medicine, I didn't realize that all these things that was done in my home was actually a form of a lifestyle medicine practice, And so I just thought, which is kind of, when I was young, particularly like in my teens, when I was like in the 7th through 9th grade era of life, you'd come home, you'd bring your friends over after school, and my grandfather would be standing on his head, and my grandmother would be chanting and doing something dang, or they'd be putting some kind of salve or doing all these things. I didn't know that was Ayurveda. I didn't know that was a cultural form of practice. I thought it was an aging issue. I thought, which is funny, this shows you how American is. I thought as people got older, they just did these things. So it was a shock to me. It was a shock to me when I'd go to my friend's house, and I would see their grandparents, and they weren't doing any of these things. They could barely get off the couch. They were walking around like canes, and and I thought it was like I didn't know it was like specific. I thought like old people do this as they get older, because when you're a kid, you just think that way, right? You see, like, I don't know why my grandparents said that. That's what they do. So I thought as I get older, I'm just going to be doing these things. I'm going to stand on my head. I'm going to be doing these poses when I come in the room, and not really understand. And then I realized, once I got the training, like, oh my God, there's this wealth of knowledge that has been in my house that I never really understood. And partly is that when you come to America as any kind of immigrant, or you're the first generation, you're always trying to fit in, right? Like you never want to say like, and I think everybody, no matter what culture you come from, we're always like, that's why we speak English perfectly, and we don't speak our native tongue, saying, my parents come in, they speak 8 languages, right? Most people come in with multiple languages, but first generation born, we're really like, we lose that because we don't want to be the kid that is that kid,
Yeah.
right? Yeah. And now it's like we want to go back and learn all these languages because we want to be multicultural, right? It's nice to have that ability. But one of the biggest turning points was, so when I was young, my dad used to tell me this story all the time as an ENT. And when people get ear infections as a child in India, what they would do is they would get coconut oil, garlic, crush the garlic, put it in the coconut oil, heat it, and put that oil in the inner ear when children get ear infections. In India, we get a high preponderance of what they call automycosis, which is a fungal infection of the inner ear, of the ear canal. Here in America, we call it swimmer's ear, for example.
Okay.
In Asia, they call it Hong Kong ear, right? Because anywhere there's humidity and moisture, stuff like that. So more like in the humid states that they would get this kind of infection more that rather than in a dry desert where I live right now. But he used to tell me the story, like, you know, it used to come up like at dinner time. These are things that when you grow up as a child, your parents will always, most people have like, oh, my parents would tell me the same story like over and over and over, like, you know, as you were a child growing up. So like, you know, here this says like in your grade school, middle school, and then you go to high school, and every once in a while something comes up in the news, or somebody complains about an ear thing, and my dad would say, well, you got to do is just do this, you know, crush a thing, put it in the ear, and it'll kill the infection. And when I was younger, you know, when you're thinking like, I want to go to be an MD, I want to be a doctor like you, Dad, you know, doing surgery at the best, you know, super hospitals and cochlear implants and stuff, like, you know, people who couldn't hear can hear now with these devices and stuff. But, you know, he used to tell me, it's like, and he used to say, you know what, you should do some research on that. You should do some research on that. You know, like, you know, you should do some research. And this would be like a little annoying kind of story. Like, you know, oh, Dad's telling me the story again, you know, 100th time or 200th time or 1,000th time. Then when I was in college, I was able to actually, I went to University of New Mexico for the summer, and I was able to meet a microbiologist. He's the famous microbiologist named Dr. Platt at the time. He was from England. And I met him, and I was like, hey, you know what? I have this idea. I want to do this study. I want to see whether there is any antimicrobial, antifungal properties of garlic against these kind of bacteria that grow in the ear. And he kind of looked at me. He's like, well, I've never heard of that. This sounds kind of weird. But he said, do you know how to make Indian food? I'm like, yeah, of course I know how to make Indian food. And my mom used to run she has 2 restaurants and stuff like that. She had a food line that was way before, you know, no sugar, no salt, and organic, blah, blah, blah. So like, yeah, of course we can. So he's like, okay, you know, he's a professor and I'm a starving student. He's like, okay, so in order for the work in my lab, if you can make me Indian food, then I'll teach you how to do the, you know, the plates. I'll teach you how to do that. I'll help you write a paper, blah, blah, blah. I'll go through the protocols and teach
nice.
you. So I was like, okay. So, you know, I was like, that was like the swap, you know, and also like, you know, in New Mexico, we didn't really have Indian, there's no Indian people. So we don't have that much Indian food. And coming from England, that they love Indian food, right? Because it tastes much better than English food, in my opinion. But that's why they love, you know. So he's like, I miss having Indian food. So I used to make this stuff. And what we did is we were learning. Interesting thing is there was a lab across the hallway where there was a Chinese researcher, and they were looking at that time. And this is like 93, 94-ish. At that time when HIV, AIDS was, you know, again, we didn't have all these wonderful drugs and things that, you know, control. AIDS patients and immunosuppressive patients would get fungal infections of their skin, right? Because the immune system is so suppressed, they just get infection just because there's no strength of the immune system, right? So just having a low immune system, you can get super infections. So they get, you know, like candidal infections and fungal infections of the skin, which is really terrible and it's hard to treat and stuff like that because their immune system is low. And they were doing a study where they would take the garlic, they would do a special form of concentrating that garlic oil, it's a way to process it, and they would apply it to these skin lesions and it would kill the fungus.
Wow.
So I went over to the lab and I was like, hey, you know, can you teach me how to do this? And maybe this will help me with how to, you know, do this for my project. So the guy was really nice. He was Chinese, more Indian food provided. And then food gets to everybody. I learned this key, right? Like, the way to anybody's heart is the food, right? Yeah. So I always say that, right? But anyways, what we did is we tested the antifungal effects of garlic extract, which was never done before, on these fungal automycosis species. And so we grow the plates, you know, we put these funguses on there, and then but what we tested against the pharmaceutical eardrops, okay? And these eardrops, the challenge with the problem with the eardrops is at that time, they're about $90 for a bottle of eardrops that the primary care or the ENT will provide. The challenge with those antifungals is they're autotoxic, meaning if there's a perforation in the eardrum, which most children have when they have ear infections or chronic ear infections, right, is that when that drop gets into the inner ear, it actually causes inner ear damage and deafness in the child.
That's
Okay.
horrible.
Now, most children, what happens, and there's no fault of the doctor because baby's crying, they go to the pediatrician, we can barely hold the kids, screaming, So, and we can't get the little, otoscope, the eye scope to look into the ear to see whether it's infected or see if there's a perforation in the eardrum. So, what most of the doctors do, they just write the prescription and they give it to the child. Kills the infection, but we now have all this data showing that when we were doing that, there's a certain percentage of kids that have a perforated eardrum, that it gets into the inner ear, and then they have developmental delay problems because they have hearing problems and speech problems.
Wow.
Right now, this is like worldwide, right? So now this has been doing the garlic. They crush the garlic, put it in the oil, heat it, put it in the ear. This has been done for thousands of years in Ayurvedic medicine. And what happened was when I went to India, did a little trek. I graduated from high school and I was like, oh, I'm not going to go to India forever because I'm going to go to medical school and residency, blah, blah. So I was like, let me go. I took a trek from north to south. Okay. It's like kind of like how people backpack through Europe. I'm like, I'm going to backpack through my home country to learn something about my culture. Cause I'm growing up here. I didn't know anything. So it was like a world of like, oh my God, I had no idea the history, all these wonderful things and the cultures and stuff. Ayurveda, yoga, meditation, mindfulness, herbal medicine. But as I was going from village to village, whether it was in the city or the rural aspect of India, and I would go to these clinics, and whether it was in a hospital or whether it was in a rural clinic, someone has an ear infection, doctor's getting the garlic, crushing it, putting the oil, heating it, putting it there. Even the ENT doing it in the office.
Wow.
Like, wow, that's something to that. So when I came back, I said, hey, Dad, I think I want to do this research study that you talked about. And I ended up meeting this guy. We started doing these studies. So we tested against the pharmaceutical standard. And then I wrote to every single garlic company at the time, right? Garlic, all these things that you say, like aged garlic extract, garlic this, garlic that. I wrote to all of them, say, hey, I'm doing this study and I want you to help me. If you can help me sponsor. I was asking for, I think maybe like $500. Like that's what I was asking for. Like I need some money for plates and some supplies.
Yeah.
And I wrote to the pharmaceutical company as well. And I get a rejection from everybody. So the drug companies say, no, we're not going to do it. There's no such thing. It doesn't work, blah, blah, blah. Why would we waste time with you? But even the natural companies, which is like all these garlic companies, because I'm like, hey, I could show you a product would work, right?
Yeah.
And I see it in India. It's like, well, they're crushing the garlic. Why wouldn't these people do it? Anyways, rejection. So I was like, oh, super sad. It's like, I have no money. I'm a poor star. And I go to the professor and I'm like, Dr. Platt, what am I going to do? I don't have any sponsors here. And he's like, he felt really terrible for me. So he was like, okay, here's the deal. You just make me more Indian food. So I was like, hey, Mom, I need more recipes, So I'm making more Indian food for him. We're doing the studies. And lo and behold, what it shows is that and there's a way to process the garlic. And I'm the one who really put, this concept of allicin. You know what allicin is? Allicin is the component of garlic. Now they have pills that are allicin, like we have in our office now. But that's the component of garlic when you crush fresh garlic. Also, onions have it as well. But when you crush it freshly, it actually creates that molecule called allicin, and that's the antimicrobial component of garlic and onion. And but it doesn't last long. It degrades over time. So if you chop garlic and you keep it in your counter, within 6 hours, it drops. Now it still has all the health benefits of garlic, but that antimicrobial is like fresh. So when I did learn this concentrated garlic oil from the Chinese researcher across the hall, there's a way that we're able to kind of stabilize, kind of like almost like a flash freeze in a way. Like you're getting it, you're keeping that high potency there. We ended up testing it. It did better than the pharmaceutical.
Wow.
Like if this is you do a plate, you put the fungus on it, and you drop these little like discs that are impregnated with the medicine, and you look at a zone of the inhibition, meaning like how much around that little disc is not growing fungus, right? That shows you. And it was like 3 or 4 times stronger than the drug.
Isn't that amazing?
Garlic does not have any ototoxicity in the ear. Okay. And one interesting thing is when we looked at all the garlic supplements didn't work at all. Because most of the garlic supplements, remember, they're aged garlic. Yeah. So that's good for heart health, right? So that's good for heart health. Don't get me wrong. Like there's other benefits of garlic, but the antimicrobial benefits is destroyed. And so these are things that, they made it a year ago. It's on your shelf, has other benefits, but it doesn't have that antimicrobial, antifungal, antibacterial kind of aspect. So data is fantastic. I'm super excited. I'm like, wow. My dad was right. Ayurveda
Well,
was right. I was super excited. Then with my naivete, and this is before I went to medicine and all this other stuff. Like, but my naivete is like, okay, I want to publish this in the best journal in America, the New England Journal of
yeah,
Medicine,
I know.
right? Because this is like
Cutting edge,
unbelievable.
amazing.
Yeah.
Right.
Yeah.
So we probably write here's the product, because he's a doc, they publish every day in these research departments. So follow the standard. And this is science. Like, I'm not doing anything like this. You
No,
follow
it's
the standard. Science is science. So, like, the only thing is I'm using natural versus a drug. And then, so I publish it. I mean, I write it up, I send it. So again, at that time, New England Journal of Medicine. And at that time, there was the editor, I think his name was Dr. Ryleman at the time. I can't remember. It's been such a long time, 25 years or more. No, actually more than 25, 1994. So I don't know how long that it's been, but long time. He was very anti-alternative medicine. In fact, he had debates with Andrew Weil back then. They would have it like on PBS of like conventional versus alternative medicine, and it was really damning at the time because, it was like, now there's so many hundreds of journal articles being published every day because the science is science, right? But back then it was like, no, we don't want to talk about anything natural. So I get this letter back because I wrote personally to him, by the way, like, here's, so you submit it to the journal editors, they read it and have they decide whether they accept your paper or not. I get this scalding, nasty letter, okay, about how alternative medicine has no place and blah, 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 and da, da, da. And literally it crushed me. Literally I sat there and I could feel my heart just sink because I was like, wait, I did everything according to the scientific method, at a university, under protocol that, they publish every day. But just because I was using something natural, it wasn't like, we had to do before we even send it for publication, we replicated. Because at first I was like, okay, are you sure? And like, just make sure like there's not some kind of error. Like, we did all these things, triple thing, 4 times, 5 times, 6 times, 10 times retesting before we even submit the data to make sure that, because this is no one ever did this in the world before. So anyways, we got scalding level about, I was crushed. So I didn't know what to do. He's like, oh, we'll just publish in the most impressive microbiology journal. That's what they do. But I was like, I want to cross over. I'm like, I want to be my naivety at the time. So we published it in the most prestigious microbiology journal. And the interesting thing, and this is where my I get to wave my flag, is that the British Medical Journal, BMJ, and the Lancet, their editors wrote editorial on my study. Wow. And they said it was the most impressive, most game-changing kind of thing because this would help people in countries who cannot afford this medications and prevent thousands and millions of potential millions of children having autotoxicity with the pharmaceutical drugs. It's something that people could easily do. The people can access. It was like this, like, wow, like a vindication. But it's because those other journals in other countries are open because that's what they do. They're not so beholden to this like pharma conventional model that you have to get a prescription and go to Walgreens or wherever to get it. And so that was kind of the big kind of change in my life where not only was I always wanted to go into medicine, but this is where I was like, I want to go into integrative medicine. It was like, okay, because it's evidence-based, as we know now, we understand it, right? It's like we're using science, but the science takes us where the science goes. Science is not biased whether it's natural or pharmaceutical. It's just, are we using the methodology, the science behind it, And so when you have like math is math, I tell everybody like gravity is gravity. It falls at 9.8 meters per second. If you jump off a building, that's what it is. I don't know. I can't say why it does. It just does, and that's the rule. So some people are like, I don't believe that. Well, like, if you fall, I'll measure you. It'll be 9.8 meters per second. And so for me, it was a shock because it wasn't like we were touting or saying something without data, right? Because that happens a lot in alternative medicine right now. You'll see people like say things on the internet, this cured me, this works, that works. It's like, no, we're evidence-based. Everything we have to pull up, like, here's the literature that shows this is how it works. This is the mechanism of action. This is how we even can make that claim or statement because there's data. So it was hard for me at that time because it was like, wow. And then eventually when I finished medical school, I was able to do some rotations because Andrew Weil just started to develop this clinic. My mom met Andrew Weil at a health conference and she's like, oh, my son. And I met Deepak Chopra way back in 1990 as a student. Wow. And he was at the non-pharmacological approaches to treatment of prevention and disease. And they had all these doctors from Harvard and Stanford talking about meditation and mindfulness and all stuff. This is 1990, by the way.
Wow.
Right. Yeah. And I was like, wow, there's MDs talking about the stuff that my grandparents are doing, and on a level that I didn't even know that they were doing in my house, and why they kept on doing it. Again, I thought it was just aging, and it really opened my eyes. I'm like, there's another way to do this. There's another way to actually. So, and partly, one of the aspects is a lot of people are like, hey, maybe you should go into, before I went to medical school, like, should I go become a naturopath or something else, like, because they use natural medicines and all. And I was like, no, why would I do that? I was like, I want to be an MD. I want to sit on the same board. I want to sit, because if you're slightly different, then they're always going to say you're not the same. You didn't go to the same medical school. You didn't take the same exams. You didn't sit on the same board exam, blah, blah, blah. So I was like, okay, I'm good. I want to sit in the same table. Like, why would I sit in any lesser or feel any lesser or be treated, more importantly, any lesser? So yeah, let's go to medical school. Let's take the same exams. Let me go to residency, family medicine. I went to the top 3 family medicine residency in the country at the time. And then let me go to the fellowship. Like, let me now go to work in the fellowship program, right? But as that's the level that you have to go, and even today, it's like you say, there's backlash, or there's this
backlash. Yeah,
but the backlash is really what I see is a jealousy, really, because at the end of the day, we're not the patient. We're helping the patient heal themselves, right? We're using diet, lifestyle,
cool.
so it's like it's science. It's not, again, it's not like, oh, it's a miracle cure, or oh, it's a secret. It's like everybody, you're sharing this right now. You share with all your clients, eat better, do this, do that, you'll get better. But again, the backlash is, I think, is only from people who have this already being lost. Like, the patients are already leaving in groves because they're dissatisfied.
Yeah.
Yeah.
So that's a little, hopefully that tells you a little bit about, like, because it's always been this quandary. It's like, so you sit on the same board, you get board certified, you get family medicine certified, you get board certified in holistic medicine, you do fellowship, you do functional medicine, you do integrative, you do herbal medicine, you do neuroacupuncture, medical acupuncture, plant-based nutrition. You're constantly learning because you have to. If anybody says like, oh, and that's the challenge with some of the plant-based doctors, is like, yeah, we got the diet right, but they don't know how to integrate anything else. So again, like they say, like, oh yeah, eat plant-based and then take an ibuprofen or take this drug for your headache or whatever. I'm like, wait, what about all this stuff?
Yeah,
it's not because they're not trained it, because everybody stops learning at a certain period of time. And I'm like, I'm learning every day. And it's like, gosh, people are like, you're going for another certification, another something. Yeah, because that's how much science is. Every day there's more and more literature. There's more and more things that are coming out. Yeah. We have to be open to that, right? Just like the diet. We have to learn more spices, more herbs, more recipes, right? Because we're missing.
You're talking about the Indian food. Sherry's husband, I think, he's Indian, isn't he, Sherry? And he makes the Indian food too, right? Yeah.
Very delicious. Yes.
Yes.
So it's very helpful for all kinds of delicious things, right?
Yeah, and and it doesn't have to be Indian food, like, but we can learn to incorporate, more spices, more herbs, and even preparations. And it's not complicated. You don't have to be a chef to learn all these things. But I think the system always wants to make things more complicated, so people get stuck on going to community. Oh, that seems too much. It's too difficult, And we like to work with our patients, like even when we do cooking classes, because we do cooking classes all the time. We go shopping with our patients and stuff. But and this is a little hard for me as well, because I'm a kind of guy, is being flexible when it comes to cooking, right? So like a chef knows how to make things when there's an ingredient missing, when you're out of something. Like, how do you then just feel comfortable with being open? But the problem is, and sometimes that we get so regimented that like a lot of patients will be like, oh, I'm missing that ingredient, so I won't make it today. Like we get stuck on, we're so hard on ourselves. Like everything has to be perfect, and we have to learn how to be flexible, like flow like the river, and flow with the round, so that you're getting to your destination. But you're not like, oh, well, there's a rock in front of me, so I'm gonna stop flowing. It's like, no, you got to keep flowing, and that's an art to the science of cooking. There's an art and science to medicine. So that's why people, I see a lot of these programs now. People like buy into wellness programs all the time. The big thing is health coaching. So like they buy all these expensive programs, but it's a cookie cutter. Everybody gets the same thing. And I'm like, that's not how it works. Yeah. It's easy to dispense. So I get it. Like, oh, it's an easy way to book patients. But for us, like, why do you spend so much time per patient? Because in order to get the success that you're really looking for, you have to put in the effort for that. And that's what we do.
So true.
Yeah,
that's so true.
For sure.
So
Doctor, I'm sorry, you go first.
Oh no, go ahead. You had the next question.
Yeah. I think that was all our questions except for the last one about saffron. And
I have it on another YouTube channel. I talked about and so you go to YouTube and you can see me on Chef AJ Healing Spices. I'm doing, one a month. You'll see like hard to see with the color. You'll see saffron that kind of looks like this like bright orange stuff. It's
Yeah.
not real. Okay, these are like adulterated. They're not bad. They're just adulterated. You'll see saffron that will come in like big tins like this. Okay, these are real saffron, but a lower grade. And then you'll see like saffron that will come in like little containers. This is a single origin from Kashmir. This is real saffron. It has a darker color. It's not going to be a bright yellow orange color. Those are always usually colored or adulterated. But saffron is one of the most expensive spices that you can get, and so it can be several $100s really for a few ounces. And so when there's a flower, and then in the stamen, there's two little, or actually three little ones that stick out from the center. It's the highest one, and then have these smaller ones outside. So it's handpicked. I should have pulled up the slide, but it's handpicked. So women actually in the fields, and they have to pick it at a certain time, which is like right at the dawn when the flower opens, and they pick these little strands, and so to get like an ounce, you're talking about like I forget, it's like 70,000 flowers. It's crazy. Like there's how much. That's why saffron's really expensive, because it's a labor intensive thing to do. But since it grows mainly, like the best saffron grows in certain parts of India. It grows in Spain. There's a lot of Spanish saffron we get. That's an inexpensive kind to get. But the best sources of it grows in the Middle East, in Iran, in the Middle East, and they have bigger flowers. They have this, and it's interesting because when they pick the most vital parts, or that we call it the king and queen of the plant, that stays there, and then all the other ones get exported. So it's until you get like real saffron. Most people in America, we get these little things. Oh, I go to the health store and I get a couple of strands and stuff like that. It's the flavor is going to be immensely different, and the health benefits. But what I always want to tell people is that when you get real saffron, is that it's not something that like you'll see at restaurants where they sprinkle it on a lot of stuff. That's a lower grade because it costs so much. No one's gonna be able to sprinkle it on rice, or like say we're making paella. I will use a lower grade when I'm making a big thing for a lot of people. Why? Because it's really expensive, right? But when I'm using it for myself, or I'm using it making an own personal dish, I want a higher quality. If I'm using it for a medicinal purpose of saffron has a lot of benefits, not only anti-inflammatory. Saffron has some anti-cancer benefits, but also a lot of the research now pushing on saffron in terms of mood enhancing, meaning helping with depression and other kinds of symptoms. I love this. I love the aroma of saffron. It's a very sweet, and that's why, like in India and Asia and other countries, you always see it like used in a lot of desserts and a lot of kind of things like that, like kind of like shakes, milkshakes, ice creams, kind of things that are like desserts. It has this nice, sweet fragrance aroma. It also has that coloring from the reddish orange color. But what I tell people is, you take a little bit, you just take a few strands. I wish I had, it's going to be like a small amount of like a pinch. And when you put it into, you got to get one of these, right?
Yeah.
Mortar and pestle. And when you rub it, you really want to grind it, and you want to grind it, and you want to keep grinding, and you want to keep grinding, and it's going to look. Let's see if you can see it, but if you grind it correctly, and it's going to turn into a powder first, so it's like this dark. It's going to turn into little flakes, but you keep grinding, and you keep grinding, and you rub it against. You got to have the mortar and pestle, and when you keep doing that, it will start turning like to this little, as you can see, it's a little bit of brighter color. And you want to keep grinding it to the point where it almost looks like a lipstick. Okay. It becomes like it's really smooth, because what you're doing is it's just crushing the compound. And the reason why I do this is because I'm trying to get and extract as much of the saffron flavor when I cook. So if I do that, I keep, I usually put a little bit more than this, but you'll see it's a little bit of a brighter orange.
Yep.
Okay. And if you do it long enough, it'll almost look very shiny. Okay. Because like if you put enough and you do it in a little thing, it'll almost look like lipstick. It's going to be like, almost looks like a little bit of a red paint. It's like, it's kind of smooth. The reason why I keep grinding like that, because then I just get a little bit of water. I put the water in there, and then I mix it, and it turns out that dark, nice orange red color. But I'm extracting all of those saffron compounds, all the wonderful aroma and the flavor, and then I put it in my food. Because if I just put a few strands, it's not going to, release. So a lot of people like, oh, they crush saffron or they put it in the rice. I would do this. So there's a drink. Sherry might also recognize this drink, but we call it nimbu pani. It's a It's a drink that we usually use in the summertime. It's like a limeade, lemonade, but we call it like limeade in India. And what they do is they just get limes, 3 or 4 limes, squeeze them, filtered water, really good in filtered water. Now we're talking about
Yep.
no bottled water, please. And what we do is we get the saffron, we crush the saffron, and you put as much or little as you want, crush it. I put the water and I mix it so then it extracts it, put it in the container, and we get cardamom, which is the second most common, second most expensive spice. You take the pod, it's organic, you crush that, put that in there, and then you put a little bit of sweetener. And you can put whatever sweetener you want. If you want honey, you want to have stevia, monk fruit. Some people put, cane sugar, but we're trying to reduce as much of that. But all these, because it's the limes, so it's like a sweet like limeade, but it has this beautiful, immense, like this reddish orange color. The lime is really fresh and fragrant. It has a little bit
That
of
sounds
sweetness.
really good.
And the smell is like, so you can put, ice, you can put lemon, you put a little mint in there if you want. It's a great thing for parties when people come over. Like that's it's not complicated, but people go, what is this? This is so refreshing and tasty. That's something that, but like I want to make it, I always want to make my food medicine, but there's so much, I think I sent you some links, like, we get some of our saffron that comes from the Middle East. So we have to order it online and, and it is what it is. When you go to the Middle East, like when I was in Dubai several years ago, when you go down the spice marketplaces, there's, the generic saffrons, and they'll show you like, here's the cheap one, here's a fake one, and here's what to look at. And people will buy the fake one all the time because they want to give it to all their family and friends,
Yeah.
Like no one's gonna. I'm not gonna spend that much on Uncle Joe. I'm gonna give him the cheaper one. He won't know. It happens. And then like this is for my wife or my daughter. I'm gonna buy a really nice one, for their wedding or something like that to give them. But but when you go to like the real like nice shops where they're really specific, like they're getting it, they will actually like you. It looks like if you went to a fancy watch store or jewelry store. It's all glass, all this stuff. They have it, and then the guy sits down with the digital scale and he takes a little thing and he measures that, and they're digitally measuring it out because you pay per gram.
Wow.
And you're like, what? Here's like I go to stores, just like here's cinnamon, here's coriander, here's cumin, here's bay leaf and all, and there's this little thing aside. I just pull it off the shelf, and people are like, that's not the real. I mean, not that saying that what they're taking is bad, but like there's a level like, wow, I had no idea. Like that's the reverence, that's the pure. There's grades of that. And I did in one of those episodes, I went through like the different grades because there's different grades what to look for. I don't have the slide right now, but maybe some other time we can do that. But that's what you want to do. And that's something that you can use saffron for. But I always like to make sure that people are usually kind of grinding it if they can, just to get, because a lot of people are like, wow, this is really expensive. And they're really nervous about using it because then they're afraid like, oh, I put in my thing and then I don't see it anymore. I put in my rice cooker, and it's kind of like, I kind of do all this just so that when I put it in a rice cooker, I'm flavoring my rice or, saffron rice, which most people will do, or some kind of, I want to get as much as you can. Now, some people like actually do sprinkle it on, but like in India or other places, I use different grades. So I might use a Spanish saffron when I'm just sprinkling it on or showing it because I can afford it and it tastes good. It's not bad. It's not adulterated. But if I'm like, hey, I'm trying to make this refreshing drink to make everybody go, wow, what is that? What is this? And that's a great thing to do when people walk in the door coming for, say, a party or, like, hey, I don't drink. Do you have anything else? I'm not drinking alcohol. Oh, here, try this. This is like, it's a nice little, and like, wow, everybody starts drinking that. So,
wow.
Yeah, I'd love to try that sometime.
Yeah, we're all wanting to try that.
Yeah. And it's one thing like, it's these are things that, once you start learning spices, that Healing Spices book is too. I'll show that, just
please do. Yeah.
But this is the book I recommend. Dr. Bharat Agarwal is a great colleague of mine. He used to be at MD Anderson, and he was the one who did most of the research in the natural cancer division of natural therapeutics. He's a super famous guy. Like all these, like 3 or 4 or 5 immunotherapy drugs is based off his research. But he's the one who, like in his, him and his 100 postdocs were the ones who studied a lot about all these spices, like curcumin and ginger, and all these things. They did all the studies because they're scientists, right? They're just looking at compounds. We don't have biased, except for editors of journals, of where things come from. We just want to see, is it something that we can use in our armamentarium for options of our patient to get better with least amount of side effects and more benefits. But once you learn some of these food is medicine, then it's incorporating a little bit of this, a little bit of this, a little bit of this, and all of a sudden, like you're treating yourself and improving your health parameters without actually taking medicine.
Yeah, definitely.
Indirectly, food is medicine.
Definitely. I want to encourage our audience to watch the Healing Spices shows because I learned so much I've tried so many new things just from some of your lectures, and I'm really having fun with it. I can't wait for your next one, which I think
Okay.
is going to finally cover turmeric. I've been wanting to hear that one.
Yeah, I'm going to cover a lot of things in the next one. That'll be next month. I just want to show this so that everybody knows my contact information here
Oh,
who's
awesome!
kindly
Thank you.
kindly listening. Okay, so you can go to sanjevani.net, SANJEVAN on NI.net. We do telehealth, so I pretty much 80% of my practice I'm doing like Zoom consultations with people or in person. If you're here, you come into Albuquerque. We love to see people. We have a wonderful center. We have Ayurvedic medicine, we have massage, yoga, we have float tanks, we do acupuncture. We have a whole store here where I formulate all our custom formulated products, always using patented, clinically tested ingredients at the clinical doses. We have a store here, sanjevanistore.com, where people can just buy things. If you go to our sanjevani.net or sanjevanistore.com, sign up. There's a newsletter option. Sign up, and then you'll get a newsletter maybe once a month or so. I'll tell you what our specials are. Usually we have things that are like the health product of the month, depending on the health month, and certain
Yep.
sales. Like we'll have a sale coming up for Easter and stuff like that. So people can, try the Bosmeric. People can read the book, and definitely I'm always open and to help anybody because our goal is to just get people better, and they can start with even reading the book in Inflammation Nation. It's available on Amazon, or they can buy through us and get a signed copy as well.
Thank you. I'd love to get my dad involved because I think I told you last podcast that he has giant cell arteritis.
Yeah.
And I just feel like, because that's about inflammation that,
It's all inflammation. And
yeah,
the key is
yeah.
the challenge that I will get with most people is because when they get such relief with steroids, right? Which we
Mhm.
need, especially you can have vision problems, so you got to give that.
Yeah.
It's a risk factor. And people go blind with giant cell arteritis and stuff like that. But the challenge is like no one's telling them again, like, well, why do you have it? Why do you have to take it? And what's the risk factor going forward? That means if you're having that much inflammation in that vessel, you're just prone to have more inflammation issues going down the line.
Right.
The
Right.
thing is that since we have that immediate acute benefit, which is great about conventional medicine, acute care is ER is fantastic, but outside that emergency room we're failing tremendously compared to all
Yes.
the other countries. We're like 60 in the bottom. Then that's the challenge because people are like, well, I just had it, I treated it, I didn't go blind, I go home. But then we always see that those people have a higher propensity of having further problems down the line.
Hmm.
And it's
Yeah.
looking at like what else that those are just like tipping points. Those are just like the check engine lights coming on, but we need to look at the tune up of the whole car because something is off.
Exactly.
And that's
Exactly.
that's sometimes I think the challenge because people feel relief so well, which is great. I mean, I would use the saying, here's a steroid right now. You got giant cell arteritis, but then they don't want to look anymore because they got relief.
Yeah. Yeah.
So,
Exactly.
so
Yeah. So I'm going to try
I,
to encourage him. So you might be getting a call from.
sure.
yeah, I hope so. I hope Richard's dad does call you. You are amazing. I don't know if anybody really appreciates just what a gift you are to this
Well,
world.
thank
And I just
you.
want to
I
make
really,
sure
I,
you
I
know
really
that.
appreciate those kind words because it's hard
You're
when you're kind
amazing.
of, in this level of in day and age when social media, like I mentioned, TikTok, it's just hard because like before all that social media, it was great because you could just do your job but now like people get so swayed, unfortunately, and so by the time they see me, it's unfortunate because like, oh, I did a program on this, I did this naturopathic program, did this chiropractor program, I did this thing on TikTok, and I saw this holistic doc over here who claimed that they were this or that. But what people have to always look at, like who's selling them or who's telling them the information, like what are their
Exactly.
training, what is their experience. And the problem is they don't say that. That's 15 seconds, you get to do this, and it sounds good. I understand why and people are interested in information, but there's so much, I'd say, misinformation and disinformation on health that if it's too easy to be true, it's probably too easy to be true.
Yeah.
Yeah,
Yeah.
it's
So I,
amazing.
I do appreciate those kind words because it's nice to hear that every once in a while. Because like sometimes you feel like it's you against everything, because the system doesn't really want people to get better on a certain level,
It's
right? Everybody has their
I
own
really
know.
interest
I
of
know.
that, and then even the reluctance from the patients because they have also been disappointed along the way through their life.
Sure. Sure.
They don't want to like, well, how do I know what you say is going to work when everything I've done for 20 years hasn't worked what they told me?
Yeah.
But we have to look
Exactly.
at the data, and you are the example as well. Everybody who's on this podcast or anybody who listens to this podcast is an example because as you do these small changes, you can say, oh wow, this got better, and you want to
Yeah.
share with the world, you want to share with everybody at church, everybody at the
Exactly.
game. The hard
Yeah.
thing is that some people don't want to change because we just been so ingrained, like, well, I'm gonna have this. I'm getting, I'm gonna get diabetes. I'm gonna get Alzheimer's disease that runs in my family. Blah blah blah. And we have to say, like, no, you don't. You can change your whole health destiny. You just got to get in you just got to have the right GPS navigation for you.
Yeah.
Yeah, I'm grateful I never had that attitude where, it feels hopeless. I'm going to get this or that.
Yeah.
I know so many people are like that, it's in their family.
Yeah, and you don't have to
Yeah.
be your dad. Like, and there's no reason to think that, but a lot of people do. Like, so they give
Yeah.
up. Like, oh, my dad had heart disease, so I'm just going to get a double, triple cheeseburger today.
Yeah, exactly. Yeah.
Not
Yeah.
understanding like maybe that's what's contributing to the same reason why your dad had a heart attack. Like that's just
Yeah.
the epigenetics is the same, and people just want
Belief
to have
system.
something to lean on.
Yeah. Exactly. Exactly.
Any other questions today?
No, but I learned so much. I know I'm
Thank you.
sure my colleagues did too.
Okay, well, I
Yeah.
appreciate your opportunity. Again, anybody feel free to reach out. I'm available for consultations and or follow us. We also will be starting our own podcast pretty
Oh
soon
yeah,
called
thank you for mentioning that. I wanted to check that out again.
Take
Yeah.
back your health. And we're setting up all the back engine. You got some support here, so I got to find people to help support on the back engine of how to do it. Because there's a little bit of a learning curve for me since technology has changed in the last couple of years. But yeah,
Right.
sign up for our newsletter, and then once we launch our podcast,
Yeah, I did sign up myself.
yeah, then we'll be glad to share and interview other people just like you guys as well, because it's about sharing the information, and it's what I always find is that
Absolutely.
healthcare is not proprietary. It's like there's so many people to be helped. There's so many people that need information, and so the more they hear it from whoever, that's great. I like that because it's just change. There's a lot of people who want to hold it and say, well, you got to come see me, or this is proprietary, or this is a secret. It's not. It's out
Yeah,
there. You can read my book and
exactly.
you don't have to see me. Like literally, you can just do everything in the book. My goal is to help people go further, like because they want that individualized, specialized attention, which is what we do. But a lot of things can just get so tremendously better just by listening to certain things like this.
Absolutely.
Absolutely. You are a treasure of
Yes.
information. And we're so thankful that you just came on our
Yeah.
podcast.
Well,
And
thank
I
you.
know my friends would agree. We would love to have you back sometime.
Sure.
Well,
Let me
I'm sure
know.
there's gonna be
We'll
more
do a whole,
questions.
create a whole list of ideas or questions or topics. By then, I think, in the next couple of months, there's probably going to be a lot more things in the news about it.
Sure there will.
And
Yeah.
and then we can even talk a little bit about the weight loss drugs or whatever else you want to talk about. We'll be good to do that.
Awesome.
Okay.
Awesome.
Right. All right. Thank you
Okay.
very much. Appreciate
Yeah.
it.
Thank you very much.
Okay.